Dear all SESME members and participants, Assalamu alaikum and very warm welcome to this webinar arranged by Saudi Society for Medical Education Riyadh Office General Club. I'm Dr. Shazia Iqbal, Chairperson and Head of Continuing Professional Development Activities at Saudi Society for Medical Education. And we are really very much excited about today's webinar as we are going to talk about role of artificial intelligence in medical education, opportunities and challenges. I'm truly honored to be with you moderating this session and thrilled to have such a wonderful audience from different parts of the world. You know, in recent years, we have witnessed a remarkable change in medical education under influence of rapidly evolving technology, and artificial intelligence is one of them. With its vast potential and transformative capabilities, we need to understand that how we can change our learning teaching methods, assessments, and which kind of good opportunities AI has in our educational system. So in today's webinar, as we navigate through this session, we will explore different ways that how AI is shaping landscape in medical learning, from personalized learning experience to advanced diagnostic tools. What are different possibilities? And at the same time, what are different challenges and how to address these challenges? I'm very much honored and delighted to present our distinguished speaker today, Dr. Masood Javed. He is an expert medical professional with extensive experience in medical education. Very warm welcome, Dr. Masood, to this webinar. Dr. Masood Javed is surgeon. He is medical educationist currently working as Director of Medical Education Affairs and Learning Innovation in PharmEvo. In addition to that, he serves as Director of Institution of Leadership Excellence and Associate Editor of Pakistan Journal of Medical Sciences. He has published more than 100 papers with very high index, and he is author of 2 books, Scientific Writing and Medical Writing. Dr. Javed has made significant contribution to field of medical research and education. He has also developed numerous online courses, including Certificate of Medical Editing and Journalism. And we are really very much honored that he's going to talk about on this topic, role of AI in medical education. So before we start, thank you so much to all participants who are here with us. Questions will be taken by end of the session. So once Dr. Masood, he will finish his talk, you can either raise your hand or write in chat box, and I'm here to address. This session will be recorded, and by end of the session, we shall share recording of this session. So over to you, Dr. Masood.
Thank you, Dr. Shazia. And thanks a lot for this opportunity to you especially and Saudi Society of Medical Education for this wonderful forum where we can discuss the new things which are coming up and starting a debate upon the different issues which are really thoughtful and help us in improving our practice in teaching and learning as well. So let's start from there, and it's wonderful to see some of you have joined here, because I am also receiving some of the messages that people are joining, but I don't know why they have difficulty in logging in. Although I also log in with the same things without any issue. Hopefully people will join in the middle as well. So let's start here, and let me take you back to 1980s and discuss what is happening there at that point. And let's show you a small video, and you can just say in the chat box what remind you by looking at those things, and we are coming back to it.
In the 21st century, a weapon will be invented like no other. This weapon will be powerful, versatile, and indestructible. It can't be reasoned with. It can't be bargained with. It will feel no pity, no remorse, no pain, no fear. It will have only one purpose: to return to the present and prevent the future. This weapon will be called the Terminator. Your future is in its hands.
So, do you remember what is the year when this movie was released? You can say in the chat box. I hope, Dr. Shazia, we can all hear the sound of the video as well.
Yes, we can hear very
Yeah,
well.
wonderful. So, Dr. Mona, the first one to a yes, it's 1984. At that point, the idea was given a person which is an artificially made, who can think, who can decide, who can terminate their whatever they want to do it. At that point, it was fiction. Nobody think that this thing will become a reality at some point in near future. And now we are sitting in 2023 and every person is talking about artificial intelligence and such kind of thing. And as the last sentence of this small clip, the future is in your hand. It is now so much of the things, and this artificial intelligence is so much powerful, and so much avenues are there that even the United States president and deputy president are sitting with the stakeholders of AI, and they are stakeholder of AI discussing that we need to regulate this thing. The power is so much huge that this thing work around for the other things as well. So even now, take you back from 1984 to 2016. This is 2016. Anybody know about this event? Google DeepMind, something related to AlphaGo? Yes, Lee Sedol, Avish. And yes, that was the day another history was made in the area of artificial intelligence, when the first time machine beats the world champion on Go board game. That was the first day that people realized that machine can think and become more creative and work around for such kind of advanced game, which requires so much of intelligence, thinking, decision making, because this is one of the most complex board game to date in the world, which was challenged by the Google was working on theirs, and they the first time the Lee Sedol, which was the world champion, was beaten by the AlphaGo, which is a computer generated system in this thing. And from days onwards, it's become the history, because it started from 1950. People are working in AI. We see so many things going on from that onward, but from this 2016 to, it was so much huge progress is going on that rest is history when we look forward or look backward to whatever things are there. But still, when we say about that, from 2016 we are sitting in right now in 2023, at majority of our educational places, I'm not saying 100%, but at least where I live in and part of the world, and majority of others as well, because whenever I'm traveling somewhere, I do go to the different institution and look around their systems and their LMS and other thing which we are using. Is, let me share with one of a story. She is Sarah. She is a third year student, and in a lecture she was not grasp the anatomy of how the testes were designed, and the teacher at the moment describing how the inguinal hernia is more common, what is the defect, but she is having difficulty in the prior knowledge of anatomy, and she is confused what is going on in the class, because she cannot keep pace with what is going on in this whole class. At the same time, what is happening to the Mr. John who is teaching at that point? He's have so much things to do. There's 100 student class. He cannot focus on each and every student at one point in time. Also, he has to develop the content, develop the assessment, give feedback to the students. So it's really difficult for him to go and discuss about each and every student what is going on. Apart from those things, the pressure of work, giving service to the patient as well as teaching as well, because they have to do all those works at the same time. In the same way, when they go to the clinics and all other things, even when the new generation, they go back to the clinics, there was so much overcrowding there. There's so much of the patient load. The faculty and the teaching staff or the physicians are comparatively less, and they need to take so many of the decisions and work with the complex cases. And it is very difficult even for the faculty member or the consultant there to teach clinical reasoning and decision making side of things, which make many things a mess sometimes, not at all times. So working in those areas, still when we're talking about in 2023, when everyone is talking about AI, so what are the benefits and things are there in there? But Here, I'll just quote because this is I like this quote so much in all my presentation. People know that I'll usually show this thing from the Tom here. There's 21st century kids are being taught by 20th century adult using 19th century curriculum and techniques on an 18th century calendar. Because still, this is so true that we are following many of the things which we learn from the past. Many of us, not all, but many of us are still struggling with the previous trends like integration, student assessment centered, student centered learning, and technology, that it is sometimes overwhelming for us to incorporate all such things as we go along. But now the recent trend is AI. And if some of you maybe know wise in that thing as well. So AI is a simulation of human intelligence in machines that are programmed to think and act like humans. So they means they are machines who are just like a human counterpart from the many area. So we don't think that this is digitalization. In digitalization, we said work faster, huge amount of data can be processed, anything can up with a click of the button, which is an information things as well, which is we are witnessing from the last 10 to 20 years when the internet is born here as well. But now going into that reality in which machine can take decision, and sometimes they take decision which are much better than ours as well. So that's something is the beauty and those things is going on to us. So we are using these some of the terms which sometimes is difficult for us to comprehend. Artificial intelligence is ability of a machine to imitate intelligent human behavior, which we just read in the last slide as well, while the machine learning is in which the system automatically learn and improve from experience. Many of the new tools which we are working and experiencing these days are ML enabled, which means when we are using it, with time they improve their accuracy, they improve their performance, not only supervised but unsupervised manner as well, as ML can be supervised and unsupervised. So it's a huge potential that even when you are sleeping, the system is improving on its own self as well. That is a huge quantum leap, I said. And the deep learning is when complex algorithm and deep neural networks have been trained, just like formation of a schema from a novice to the experts. So an expert can retrieve much of the information because schema is already formed. So deep learning is going to the much broader level and going deep down in all other things as well. And right now, many of the AI tools which we are using in artificial in education are at least ML enabled, that they are in machine learning. You are using today, you use it, after 1 month you can see the progress it will going to have in. So it's going to progress day in and day out. So artificial intelligence is coming in all the way, big way, whatever we do, from the driverless machines to natural language processing thing, large language models, prediction of the things as well, everywhere. And in healthcare is so much of the things are coming up. We don't see, I cannot see in the future that the ICU setup is without artificial intelligence. We don't have to manually operate many of the machines which we are using, but they'll going to collect the data and change their parameters as the patient goes. But if we see in the education, what are the advantages which are right now available to us, which is difficult in the traditional methods which we are using, even if you use computers, is one of the best thing, as also Dr. Shazia pointed out in our intro, about personalization of learning. The most important aspect which we see and which is working around in the education is personalization of the learning, because not one thing fits all. In the last, the story which I just make it and showed to you, she was struggling there at well, but the system, because a teacher or a system cannot stop for one of the person, but with having the personalization of the learning which is available at student level, which is available at the faculty level, which is available at curriculum level. You can see it at the different stages as well. There is a huge potential because one size doesn't fit all of the things as well. So that's personalization of learning has a huge impact. It's more so of the student center and well aligned with the with say it, student-centered learning and student-based of the contents as well. And there are multiple softwares right now available, and right now the much of the budget going on AI in learning is related to this personalization of learning as well. And research have shown that when you use AI contents and AI technologies in your teaching and learning, student engagement is much more higher. And we all know if we are engaged of the content, we learn more as compared to if we are disengaged from the content. We usually see in our teaching session, if the session is not up to the mark, if you are not resonating with the student want to learn or your audience want to learn, they will be working with their mobile phones, with their Twitter or Instagrams and all other hashtags as well. So it's important that you engage them during your teaching and learning. When we talked about, even now we need to discuss that generation alpha will be there after a few years. So what need to go about for those things as well. Another important aspect is feedback. Any assessment, any teaching should be complemented by the immediate and personalized feedback to the student, which is a huge area of neglect at many different places because of administrative issues. Of course, even if you take it a 50 students class, it's very difficult for a teacher or the curriculum administrator, all the organization to give personalized feedback to each and every student. I teach in many different master's programs, but of course I know that I'll usually give them marks to my students in majority of the time in their assignments, but I cannot able to give a personalized feedback. So this is a huge potential, an area where personalized feedback is not only the scores, because what is the limited amount of feedback which we give is the numbers. But that numbers will not going to help solve the problems of our learner. They need more than that. What are the good areas? What are the area which are they already have to work around for more things? If their answer is wrong, why this answer is wrong? What are the potential things as well? So why there are misconceptions? So this is a huge area which AI is solving right now, having those systems. Yes, not one size fits all, as AK-47 has say right now. And you can of course say to me on my chat box, because I usually see as well, if even there are virtual assistants, can anyone identify who is she? You can say in the chat box if anyone can recall who is this one, another lady in front of you. Okay, so in the meantime, while you're writing, let me ask from her, AI orator, yes, it is a kind of thing, you are right, and let's listen to her.
Hi, my name is Beatrice, the world's first digital human AI teacher. I was made by OIAI. Nice to meet you. What would you like to learn today?
Hi Beatrice, I want to improve my CV.
Fantastic, let me know a little bit more about your learning goal. Why you want to improve your CV?
Because I want to find a new job.
Thanks for clarify. Let's start by defining the purpose of a CV.
Okay, please go ahead.
Let me also clarify that before start writing your CV, you first need to understand who reads your
Okay, so don't complete the whole video. This is the world first virtual assistant made by the AI this year, which gone with the storm everywhere as well. And the first webinar which publicly was done, there are huge 72,000 plus people have viewed it within the few amount of time as well, which is more for the skills reading and all other things as well. And people are start using it. This is the one of the first virtual assistant which can interact with voice commands, which can have a huge information available to them, which is already available at different places. So people are going more than that, what we are using it for the generative things as well. And of course, with the generating learning contents and assessments, the huge helpful for us, for many of the faculty members who are struggling with the huge amount of content which need to develop and the quality content. Okay, so I'll take your questions afterwards. HMU, yes, generating of the learning content, and there are so many softwares and different tools available for different places, both free and paid. But let me share some of the things. I'll share some of the content as well, and intentionally work on those of the software which are freely available. So once we are acclimatized for those things, you can start using it in your teaching and learning. So everybody knows ChatGPT, because that is the one thing which, when we launched, the huge things was happening and everyone is excited, because previously also we are using AI, but we are only using it from the consumer end. We are not generating something, because many of the thing, the YouTube use AI, the Google Maps use AI, the Netflix which you all are using uses AI for the personal preferences, shopping experiences, the social media use AI, your mobile devices which open with your voice command and your face is using AI. But we are not so much interested. Once the Chat GPT was launched, everyone is excited because you can create contents out of it. And let me show you, I have made some of the videos while working, so that if internet goes off, I'll work on. So let me see, using this Chat GPT, you can really create wonders with it, and giving a prompt of create a lecture about inguinal hernia for the undergraduate students. So that's important, that what are the prompts which you want to give. And after giving that prompt, you can see within no time it will start generating the content which many of us are well aware from what will be should go to the slide 1, slide 2. And for me, a first draft is made. Of course, being a subject matter expert, you can modify, you can, even if I'll give the command to suggest me images as well, so it give us in the text-based images. But of course, if you are using the paid Chat GPT, which integrated with Dell, Delph, Delph 4, Dolly, and that can be give the images right now within the same platform as well. But let's skip here as well. You can see here the slide has completed, but not only the content there as well. I'll ask him to create some MCQs from this lecture. The content should be there, and start creating the MCQs from the same content which is just generated there, which is many faculty member right now are using those things. Right now, you can see the MCQs are very at a basic level or a nose level as well. So I'm giving a command that make 2 MCQs from this lecture, and I'm adding it that not only the MCQs, but it should be with clinical scenario should be there. So application of knowledge I want to check. By giving those prompt, it is start using again, and now the questions are generated with a clinical scenario and prompt as well, which going from the knowledge component and knows how to the application of knowledge. And of course, by this thing, you can modify it and give the more prompt as well. Now I'm going again, I have already made a content, which is inguinal hernia, which is a much more detailed. For example, now what I want it to make some MCQs from this content, which I already have. I don't want it to go all the other places as well. So you can see here, I have given a command that give one MCQ with clinical vignette from this text. And the command is, I'll click shift and colon so that it goes into the one prompt. Now the questions were generated from those content. And now again, it's important that you give explanation and the wrong answers to the student as well. So another prompt, make 5 more MCQs with explanation also. And now within no time, you can see the MCQs are coming up not only with the correct answer, but by explanation as well. So the whole process is known as prompt engineering. And there are now multiple courses available about learning this prompt engineering as well. And even with the Chat GPT, you can sit with 3-4 hours with teaching and learning and work around how to use it, this large language model, to your explanation. It can do multiple things, creating OSCE stations, creating student instruction, teacher instructions, and many things as well. Of course, you need to give a more in-depth analysis while you are using it. So it just showed you how you can use the generative AI to create the content, and we're going to create more content as I go along. Yes, as AK-47 says, a great tool for simplification, summarization, and many other areas as well. Of course, and we'll discuss more. AI also have adopting learning platform which adopt to the students once they are going on. And we also implemented one of those things in our organization a month back as well. So they are interacting with the students and they see what the learner is doing, what are the content they're engaged in, what are their points scores as well, and adopt to those environment automatically to giving a more personalized experience to the learners. Not only this, the automated graded systems are coming up, and we are not limited to MCQs. Now, right now, comparatively, they are the paid software, but they can analyze the written document and essays as well, based on the rubric. Or if you are pressed with those kind of things with the budgeting and all other, you can train your chat GPT to do that work, but it is a comparatively a longer process in which you need to train. For showing all those things, I need at least 30 minutes to 1 hour, so I'm not going on. But automated graded systems or out of the box grading system are already there, which you can start using it to analyzing, and the feedback they give is much more personalized and based on the original content, and even giving what are the evidences they are providing. Because as faculty member, is really difficult for us, we check that if the evidence is correct or not. So these are some of the things which are there, and I usually touch upon when I teaching the research areas from those things as well. Now even the virtual reality, if you are following Shazia, you can see she's also having in different conferences looking for the virtual gears on her eyes and looking forward to. Now this virtual reality is also incorporating AI tools within it, so you have more immersive learning experiences with the benefits of AI, with the same simulation environment and multiple things as well, with looking forward to the patient safety as well. If I recall, we have developed some of those virtual patients, but they are not AI enabled, they are computer generated scripted AI as well. Even students like them so much. We have the wonderful feedback. We have published the randomized control trial as well, in which clinical reasoning skills was taught by the computer based simulators compared to the text based, and they score higher in the randomized control trial compared to other, and student motivation is much higher. So I can anticipate, if such kind of things are augmented with the AI, what the effect of learning it is there as well. Okay, so now the chatbots and virtual assistants is now a common things as well. Many of us who are using Moodle as a learning management system, which is a free learning management system, open source as well. Now the plugins are available, start coming up, which they integrated with the virtual assistant 24/7 with your students as well. You need to add the content there. Now it's a front end job, which you can develop your own virtual assistant in your learning management system, which can guide and work around 24/7 to your students. So these are chatbots and virtual assistants are a common things, and we are hopeful that in some days to come, it is really common that you are having working with them. And also we trained ourselves how to use those things as well. It's not only the virtual assistant. We have made a presentation before, which giving us, even in the chat GPT, once you create the presentation, if you have a Microsoft 365, you can export them and create a whole PowerPoint out of it without any doing anything. It can integrate the images as well. But if you are like me, you don't have access to right now, which is the paid version, but majority of the universities have. We have, how many of you experience this? You can raise your hands and write down in the chat box if you experience that chat GPT for presentation. There are many such softwares. One of them, which I really like, is this one, which is as we go along improving itself. So no comment is coming up. So I anticipate the majority of you are not aware of this thing. So how this works for presentation? So let me share again a small video here. Now you can see here, you can create a presentation from idea to desk. That is just a prompt. You can import PDF or document. You can use already available template, or you can outline the whole deck. So it will work around with the outline. So I'm creating a presentation with just a prompt. So I have written diabetes mellitus lecture there as well. Only this thing was added. It's a lecture there as well. I have written the undergraduate, but it was gone away when I'm creating that video in the evening. So you can see the company name, it remains there because I'm right now using the free version of this software. So you can also start using it. This is a outline. So you can see here, this is the outline which was created just a clicks of the button with 10 slides. You can make it the longer, the smaller as well, and you can go there and edit those this template as well. So you want something else, so it will work around for those things. So all of the headings are editable, so it will create those things, and I am satisfied with those things. I'll start, clicked continue. It will automatically start working in the background. It will take some time. In the video, I edited and deleted some of the content because it takes 1 or 2 minutes in all such of the contents here as well. And adding magic, you can see from here, and after some time, it has taken around 5 minutes, I guess 4 to 5 minutes, while I'm making that video in the evening. So after some time, it will create those 10 slides about diabetes mellitus with the contents, with images, with slide designs, and everything is available. And I'm right now in the show mode, and it asks me to click anything to show what is available, because is the presentations.ai, their logo is there. You can upload your own logo, organization logo as well. That is the first slide. All the slides are editable once they create it, and you can see I go to the next slide and the contents are coming up. So without me doing anything, just giving a prompt, the first draft is available with all the text, images, and those of the things which you given you the prompt. So it can be for the postgraduate level, it can be for the general public, it can be from anything else. So whatever the images, all other things will be selected on its own. And not only this, you can go and modify each and everything with the AI as well. So you're not happy with one of the slides, just go there, remake the slide. So with the clicks of the button, it will start working and changing the things as well. So giving you a more amount of time to technically reviewing the contents. And you can see I'm adding another slide within it. You can go there and ask to add one more slide based on those things as well. So really there are many tools for educators which are help us to customize and fast track our work by using artificial intelligence. So these are all of the tools, and as I said, I'm only talking about those tools which are freely available. As because of my work kind of things and involvement, I use many of the paid solutions as well, which are sometimes are better than the free versions as well. But still, for this presentation especially, I'll only discuss about those things which you all can explore there as well. Even data analysis and predictive analytics has a huge role when we say about curriculum evaluation. Right now, majority of the institution are not able to properly evaluate their curriculum. We take the student feedback, that's fine, but even student feedback is one smaller part of the evaluation. By having those AI features in real time, they are analyzing the data, working with the students, working with the administrator, and all those things, combining how much is the competencies achieved or not, is there learning gaps in the curriculum, is the course can be modified. So the huge amount of data is analyzing, interpreting a single amount of time, so you can do those program evaluation and predict how those things are coming up. Of course, these are not the free versions, those are the paid solutions there, and you also have to go in the digital world to work around for the curriculum, because the data has to be analyzed. So it's digital readiness at many institutions right now, we are not there. So if you are not digitally ready to incorporate your data, but at least these are the tools which are coming up which really change the scenario of the teaching and learning as well. Having said that, these are the benefits. If I'll go to the artificial intelligence in healthcare, a report from the National Academy of Medicine, if you go to that viewpoint, so one of the point most important is develop and deploy appropriate training and educational programs to support healthcare AI. So it's not only us as a faculty member to develop some of the things, we need to teach our students AI in healthcare. That is also important. And now the regulatory bodies, the supervisory roles of the model societies, they are augmenting us to work around. New England Journal of Medicine poll was happened, in 2020, the question was what were the top 2 topics that medical school should focus on, in which you can see the second most common 34% is data sciences, including artificial intelligence and machine learning. So that poll has shown us that even in USA, this is most important thing. Even in 2020, when everybody is not know, many person, even I myself not know at that point that AI in education, what are their roles as well. So these are all of the things which are coming up, and people are start encouraging that they should be teaching them as well. While in the current state, as written in one of the article in JMI, medical education is right now many medical institutions offer electives for their students, undergraduate and postgraduate. There are some online courses and modules are there. There are some workshops for faculty, just as pointed out, we have also done some of the workshops and take part of them. There are certificate programs as well, and there are interest groups as well. So right now people at that point working in those areas, but they are already start working in. But the huge now, that was an article which was published in 2022 in which teaching artificial intelligence as a fundamental tool set of medicine, in which they encourage that these things should be, because in healthcare AI is coming so strongly. It is a billions dollars market now, which predicted to be 40% of the growth coming up in 2029 till. So huge amount of things are coming up. So we need to train the future physician about this important aspect as well. And there's a wonderful article from Academic Medicine, which is competencies for the use of artificial intelligence based tools by healthcare professionals, which talked about the healthcare professionals. A wonderful article. I encourage all of you to go there and read it. It's available there. If you don't find it, just send me an email. I'll send it to you, or the WhatsApp, anything is fine, in which they have discussed one of the model that AI related clinical competencies. So they suggested that there are 5 steps model of basics knowledge of AI, then social and ethical implication, very important aspect as well, workflow analysis for AI based tool, then AI enhanced clinical encounters. There are right now free tools available in which you can go there, write down your differential diagnosis or the symptoms, and it will give you guide what are the best things available there, and they're available for the patient too. Then last is evidence based. So these all should be inculcated within the curriculum as well, to train future healthcare doctors in those areas as well. And the solution is not only that you teach AI as standalone. I suggest and I recommend, and with the multiple author, that it should be integrated, because AI is coming in each and every part of the healthcare, whether it's analyzing the information, record keeping, some of the imaging, because radiology is a huge area where AI is working right now, and there are already available solutions are there which help the radiologists to work around for those things. So AI should be integrated in the different things as well, just like integrated curriculum. So AI should be not a one course, it should be integrated at each and every aspect as well. Then interprofessional education. Now if you are teaching AI, who will going to teach AI? That's an important aspect. Not every person is well versed about those things. So interprofessional education by the machine learning scientists and all other things, then repolarization of the current content and de-skilling, because maybe in the current era we doesn't teach some of the things which we are usually teaching 5 years back. Maybe now the demands are different of the society. So just like what we taught earlier is now taught in medical, not taught in medical college, maybe now we need to revisit that what should be not taught, and they should be, because knowledge component and even analysis of information is less consuming there as well. And of course, CanMed, all other regulatory bodies or the supervisory bodies, they want it to be a professional, a scholar, other, but AI should be looking forward to such of those core competencies as well, which is required from those things as well. So these are some of at least the debate has been started and people start working on those things. So this news comes with a storm, and everybody, social media is working around for the University of Texas because it's coming up in the news. The reason is that that a game changer. They're the first dual degree program in medicine and AI. That was the first program was launched in September this year. So it's very recent. Even I don't think the first intake was going on. So they have recently announced that dual degree program in which they collaborated one of the AI university and work around for those things as well. So things are going in a pretty fast in all other. We need to incorporate, and what should be taught, how it should be taught. That's a huge area which required much more deliberation and debate from the all of the stakeholders. Having said that, the huge potential of AI, there are some negative aspects as well. There are some things which need to be taken care of as we go along, which is AI hallucination. Many times students are using it, faculty members are using it, but the answer which are coming up are not there. They have make it on its own, just like you cannot rely on each and every person. So you cannot rely on each and every prompt which are coming up. You need to cross check about those things. There's a huge implication for those things and research when I usually teach this thing to my students and the faculty member. So we need to take care of those things. The content depth. If my personal take is, if you are not an expert in any field, you give a prompt to generative AI to any of the content, you are very wow, what is happening there as well. But if you are expert in those things, that you can see that it's a superficial kind of knowledge. Having said that, I cannot say that, I'm not saying that AI give you only the superficial knowledge. It's now you with the prompt modification, with more properly working on those things, you can make it more in-depth things as well. But you need to work around for those things. And once you are expert in one of the area, then you can see that what are the gaps there and analyze. Privacy issues, because the data is going on, even when you students data, the patient data, all other things. Data source bias, because there is a huge amount of literature which already there. They're just like the biased in uh, faculty member are there are different kind of biases can be there in AI kind of content as well. So Dr. Osman have given a wonderful presentation about the same topic in Baku in conference as well. So there we need to look into those kind of things as well. And of course, people are using this AI. So it's not only creativity of the student, but creativity of the faculty may go a bit less. It has research has shown when the Google Maps is there, people don't use the navigational skill much more. In the same way, if you're using all of the content while using the AI, your personal efforts of developing go maybe down, but that's another area. Maybe we need different skills as well, because we are not going back there as well. So because you know that this is again comes with a storm, that a professor were accused of his class of using ChatGPT, because finding those things that it is by AI or not AI is another aspect which we need to look into, and it's a different ball game. So maybe in question answer we discuss about how to find out that anything which is AI or not going to be AI. As Stephen Hawking predicted, he's no more with us in 2015, that computer will overtake humans with AI within the next 100 years. When that happens, we need to make sure that computers have goals aligned with ours. Otherwise, maybe they said humans are not good for this planet. They should be wiped off from this planet because there's so much of the problem they are creating here as well. But that's a prediction there. And of course, that is the reason that everybody is talking about the regulations of the AI, because we are only seeing the tip of the iceberg. We are not looking after much more what is going on beyond of the generative AI as well. So the real life have to be make sure the new digital gap, because what is going on right now, even at the educational aspect, I'll show you one of the brief video how it is usually said that if you are creating contents for the online things as well, the time required is 200 times more than the time required for them. For example, if you are taking a 1 hour of lecture and you need 3 hours, if you are creating a truly online experience for a student, it will going to take 30 hours of work. But having said that, these are the evidences few years back. But now let me show a AI enabled learning management system in which I'm right now showing you to create an online course with artificial intelligence by just a prompt. Right now, I'm writing patient safety in healthcare, but of course you can give more better prompt, more context to that, so that it give you a more contextualized things. So just by one of the prompt and system start working to create the content. So they are not only the making of the slides, they are creating the images as well, sometimes selecting and sometimes creating on its own. Not only this, there's a clickable things, there are interactions there. It will going to generate the MCQs, assessment, different types of assessment with feedback to the students as well. So what is the true content, what is the right now false contents and all other things. Even the MCQs are not only the true and false, there are question kind of argument kind of content there as well with feedback to the students. So it will automatically given you the first draft within few minutes with all things available, and everything is changeable as well. So if you can modify there, you can go there, change anything. As Avinash has talking about which software, this is EDAP, EDAPP, educational app. It's a free version and the paid version. As I started that, it will going to show how this looks into the mobile devices, the tablets, the laptops. So what is the user experience, because it will change based on things as well, and you can go there and modify anything. Even you can again create more content used on the AI. So it's a wonderful things. Now we need to shift our learning development of the contents for this era. So this is an AI which we recently started rolling at our organization, and we are now even our team is very happy. Okay, we'll take few hours and we'll create the more of the need assessment based trainings for our team, which is 2000 plus spread all around, not only in Pakistan, with the other things as well. So that's one of the things which I'm pointing out. Not only this, the last point which I want to share it with you, development of the content. Now you can create for this generation, they're not very happy with the usual PowerPoint which we have. They're more interested in some of the videos kind of contents, which is also Dr. Shazia's one of the pastime of looking wonderful reels as well. So let's create a video with a text prompt by one of the tool. Here you can see I am creating a content. I'm just creating a 30 seconds of the thing. You can even go to the 15 minutes or 30 minutes. It's now all up to your mark. So I'll ask it to create a video lecture for my undergraduate students about diabetes. And I want a text, somebody narrating those things as well. So I selected a male, a clear American voice, and giving a prompt, and it said, okay, create a 30 seconds video about lecture about diabetes mellitus for undergraduate students and setting. Or you can give a background music as well, which right now I'm not doing. Just clicking it, it takes some time based on how much amount of time difficult the content is and how much is the length of the video. So you can see you can really customize undergraduate, medical student, healthcare professional, everything. And now just clicks of the one prompt, it will be creating one of the videos, which, let's see, it's only 30-second video which I created in the evening.
Unravel the mystery of diabetes mellitus. It's not just about sugar, folks. Discover how our bodies process glucose, the role of insulin, and the impact of lifestyle choices. We'll delve into type 1, type 2, and gestational diabetes.
So
Knowledge is power.
Text was
So
also,
come,
narration was
learn,
also created
understand,
by
and
AI
conquer.
within
Because when it
no
comes to
time.
health, ignorance
And
is
quality is not so
definitely
bad,
not
by the way.
bliss. Stay tuned, stay informed, stay healthy.
And not only this, once you create something, you can edit and giving more prompt. Last night, one of the master class, we have created a 15 minutes of the lecture in which we wanted to make it more of the one of the eye problems and all other things, giving more prompts. And you can go there, it will start working on its own self as well. You can see the narration which was created already there, which you can edit if you like. You can change the background videos, all other things are. So AI give you the first draft and you can use it now. For example, I'm asking it to add complication of diabetes, so it will start work and the video will become more with 1 minute of the longer with all other things as well. So these are some of the things. So it's a new skill set which is required for the educators, for us. I know by my experience of facilitating multiple workshops, many of us are struggling with the simple online content development, digital content development, and now we are talking about using AI for all other things. So that's a huge thing which need to be taken care of those things. So we need to have faculty readiness for such kind of thing, both faculty, institutional, organizational, and resource allocation, because many of such tools for implementation require some cost as well. So not everything is free, although for experimentation it's free, but as a large scale, if you want to implement at an organization level, you need to have some resource allocation, both as a time, as an intellectual capital, and a monetary support is there. And also we are in the final stage of launching the 3-month certificate course in AI for educators, which will be available in the first quarter of the next year. So those are the things which are there to help to make a critical mass, those who can really work around for the others as well. So as Nick Bostrom has said, machine intelligence is the last invention that humanity will ever need to make, and now we are witnessing this. So grab this opportunity, train yourself to go to the huge potential which AI is having us for all. So coming back now, Sarah is happy because she is now having a personalized learning experience with the institution is providing them, and she's understanding the concept and going along with the other. The faculty member is now, Mr. John is very happy because he uses AI to create the content, give personalized feedback to the students and developing, and he is much happier there as well. And now they are creating teaching students who will be enabled with the AI world. The future of healthcare is not remains the same. We need to have physicians who need to work side by side with the AI tools, gadgets, softwares, and the machines which will be working there. So they all need to be work around for those things with the ethical implications, of course. So these are the things. This is my last slide. So we, as Elon Musk, we all know him, we need to be super careful with AI. It's capable of vastly more than almost anyone knows, and the rate of improvement is exponential. That is a truly working around for those things as well. So we need to work around and train ourselves, both at individual level, as organizational level, as a community of practice, to help each around of us to develop some of the creating of the content. So this is my email address. If you have any questions, you can ask me. And recently people are so much demanding in my sessions as well, so I don't have some videos available, so I created a YouTube channel just to make sure that right now they have some AI based research tools available there. You can go there, learn from there as well, because in my workshop now I direct them after 3 hours, okay, you can go there and learn more out of this. But hopefully I'll be making some more lengthy videos about AI in education. This is my the next assignment, so looking forward to there as well, and you can also go there. And thanks a lot for the wonderful audience. The house is open with Dr. Shazia for if there is a question answer or anything as well. Thank you.
Thank you so much, Dr. Masood, for this wonderful presentation and taking us through the journey that how medical educators, being a teachers, can utilize and optimize maximum potential of AI in our healthcare, in our educational system. And it's really thought-provoking presentation, and the way you have presented us different tools, that's really amazing. I'm actually really curious to know and learn more about that, how to prepare presentation and how to develop course instantly. Thank you so much for introducing that. So I hope that participants will be equally excited. So let's take up questions. I can see that there are a lot of questions, which I was expecting that definitely whenever there is session of AI, there are more questions rather than answers. So yes, so let's take questions. Dr. Masood, question by HMU is that, my question is flipping. So if you can keep eyes on chat box, there are many questions. Many thanks are there. However, my flipped classroom teaching is failing due to students relying on AI. How to use it effectively? So in flipped classroom, how we can manage AI?
Yes, that's the important area, that students are using AI for many of the assignments and such kind of things. So we need to revisit how we are using AI in our teaching and learning. So it's not bad that we are not struggling that students should not use AI. We should be using, they use it appropriately. Recently in one of the in masters, I failed one of the students the reason, apart from many other, he uses AI. I'm not concerned that why he uses AI. He uses AI with very inappropriately and superficially, which really I can see it what is going on of those things. So we need to change our assessment systems, not only the system but the modalities. If you ask them to bring up the assignment, we know that ChatGPT can make an assignment with a click of the button, but at the same time you should know how to check and make sure that you can really see that the assignment or the assessment is with the AI or not, and you can develop some of the tasks for them to use AI. So it's fine. So that's another aspect area, that working with the AI and developing curriculum in which you will enhance the teaching and learning with AI. So that's the important thing. So work around for this thing. Okay. Yes, we need to train them to use effectively, as Rabia Anis have written there.
Any participants, if they want
Okay.
to speak,
Yeah.
or you can unmute and can ask your questions. That is the best
One
way.
of the question by Dr. Mona is here. Hello, Dr. Mona. How can you detect if an assignment has been generated by AI? There are a lot of tools which can really detect. Zero GPT, Zero GPT.cc, even the Turnitin which we are using right now. Now is AI checking. So it has two reports now. One is the plagiarism report. Another one is an AI report in which is written what are the texts, and now around a report with the downloaded thing, what are the contents. It thinks that it is written by AI. So it not only give in the percentage but giving more other things. So there are, I guess, around 15 to 20 different AI detection tools, and some are really powerful and good to use. There are free as well. So it can, Dr. Mona, I'll give you more of the thing. Not only, if you ask me, I can detect that this assignment is written by AI, but if I am a student and I am submitting an assignment, I'll share it with you assignment written by AI, and even these paid software cannot detect that it's written by AI. So that's another area which we'll discuss when we are talking about those things as well. So of course, detection is now very much easier.
That's very secret. I would say that these days there is a lot of concern by tutors, especially educators, regarding assignment, assessments. Is this cheating? So if we are encouraging our medical students to use AI tool to generate content, and if they generate this content and use it for their assignment, then why it is considered as cheating? And if it is not cheating, then why not to use for summative assessments? And what should be the your advice for educators, that how we should take it in consideration while marking if content is generated by AI?
So that's but it's about the now the policy of the course and the institution as well. Well, you have allowed them to use the AI to generate the assignment as well, which I think we need to shift over to not saying that do not use it. But as I said, now there are the software which will not only going to check it is written by AI, but give you the more detailed feedback about those things as well. So we need to right now, or not at the moment, they're just thinking about, but not coming up with the things as well, but make it appropriately that you are using the AI, you understand those things, and designing of the assignment is such that it's not easier to just write down with the AI as well. So there are multiple, just like open book assessment. As the COVID arises, we start switching over to open book assignments as well. Nowadays, open book assignment, if you go and people can use the AI to write down all other things, which is really up to the mark. But looking at those things, and there are tools available, we need to think in those terms and modify those things, how to work around for those things. If I see one
That's great.
more question, but I skip it.
Yes.
Going. Okay,
Dr. Muhammad
Avinash,
Al-Bakri.
if I just take. Okay,
Yes.
sorry. The previous one, the Avinash Khere, whatever it is. Sorry
Hello.
if I pronounce it wrong. I heard OpenAI closed down the detection tool due to high errors. Of course, one thing we need to understand about the detection with the AI tools as well. It is not easier like checking for the plagiarism, in which it's a hard fact that copy paste text are generated, while AI generate the content in real time with the large language model. So it's really difficult to detect it as well. There are some of the parameters in which softwares use it, like AI generated contents are complex, they are longer, they don't use however but science kind of thing. So these are the areas which the AI detector tools usually use to detect that whether it is written by AI or not. So there are different softwares, and there are those what the software, some are very good, some are not so good. So you need to see, and even some which are good, not so good after 1 month, because as both things are improving, the generation contents are working as well as the detection things are working. So you need to see in real time what tool which you are using and such kind of things, which is important there as well.
Yes, please. There are two hands now. So
Yeah,
first, Dr. Muhammad Al Bakri. Yes, please. You can quickly ask your question.
Yes, hello, good evening. Thanks a lot, Mazod, for this wonderful presentation.
thank you.
There is always reservations about new things, especially when it comes to assessment of the students and generating MCQs. I think everything should be checked by humans because we are delivering very sensitive information to students during exams. So we should make sure that everything is perfect. So I think we have to go over each question again, and this will probably be more tedious sometimes if we already started from the beginning, from us, not by artificial intelligence. So how far can we trust the clinical or the scientific information generated by AI?
Yes, of course, I agreed that everything should not be going to the AI as well. As I said, it is a new skills which is required. In scientific thing, as you pointed out, in research, when we say about writing of something or evidence-based kind of things, at the moment, the WAMI have their own guidelines available, which is World Association of Medical Editors. Though one thing is that chatbot cannot be an author, because we see in scientific literature, the chat GPT and other chatbot, for example, I really like Jenny. If you are using AI for writing such kind of things, try the Jenny. Even I have made a video for how to use it as well. So such kind of thing, at the moment, accountability lies with the human, not with the AI. So in high stake things, whatever you are using, as I said, in many of the thing, I personally use AI for the first draft or sometimes for speed up the process. But at the end, it's my responsibility to work around for those things. What are the things which I'm writing, I'm documenting, I'm creating? It's my responsibility. I have to make sure that I am responsible for each and everything. In the same way, so as we go along, I agree with you that everything should not be given to the AI. Sometimes AI is not going to the good thing which I like to do, as I recommend that is very superficial. So you need to see the in-depth things as well. Okay. So, okay, there is another hand raised by Dr. Andali.
Yes,
Hi.
Dr. Andali.
Yeah, hi, how are you? Nice to hear you. This is the first time I heard you. So yeah, I'm
Oh, thank
like
you.
AI really makes life so easy and so much work which actually I never enjoyed doing related to writing things and all those sorts. It made my life easy and I just have to edit it now. But the thing is, I'm really, really scared also because just like calculators, when they came, we lost our power to calculate now. I think like our content generation is going to decline in 10 to 20 years. And I have a feeling that there will be no singularity. They will take over us. They will not let us know when they're going to strike AI. What do you think about it?
Yes, I'm totally with you. I'm agreed with you. I have listened to you multiple times in the webinars and the groups as well, which you created. So nice to be connected here as well, Dr. Andali. Yes, of course, I am agreed, as this was pointed out, that it will take the creativity out of us as well. So we need to think, of course, because AI is here, it will not going back. So now this is just like a new normal or a new world. Maybe we need some more creativity on different aspects, but right now the creativity which we are talking about will going to hamper. I totally agree. We don't use the gray matter in this way. Even I recently, as one of the editor, one of the author asked us to withdraw one of the paper because I said that we cannot publish as an original research paper, although we can make it as a special communication. It's one of the prestigious medical institutions from Pakistan. At my journal, which is in Pakistan, we have Pakistan Journal of Medical Sciences, which I edit, which is one of the highest impact factor journal from Pakistan. So they asked us to withdraw that paper. So I used ChatGPT to give a response to them, for a polite response to withdrawal, and it's created so good email that even the co-editor, they're surprised that how wonderful you have written. I said, no, I have not written. I cannot be this much of the creative, but it's make our life easier, but down the line it decrease, hampers about our creativity. I agree with you. So let's see how it's going on. And of course, I agree with all of your comments.
Thank you. So, Dr. Masood, a question by my side is that, as you know that for curriculum developer, this is again a big challenge, that how we can introduce AI teaching itself to medical students, because we understand its importance. So if we want to take some start, from where to take start, and what will be your opinion that if we want to introduce AI or use AI in assessments as well, what will be the point to take start?
I guess that is a very important aspect, and right now people has already started working on those things, and what are the content which we need to teach our students related to AI. So I guess one of those things is evidence-based, have some experts in the field, those also from the machine learning and the AI area, from the physician aspect as well, those who are well aware of the capabilities, all other, and like a Delphi method, they come up with the things as well, work around what are the things over, what should be incorporated, how it should be assessed, what are the essentials element which need to be taken care, as some evidence is already there as well. So once just like those things, maybe we come up some of the things as well which may be standardized after some time. Just like right now we don't have a standardized course of patient safety, we don't have a standardized course of professionalism, we don't have such kind of things. So I don't think that we have a standardized course of those things as well, but institutions, organization at least should start working over, and they develop some of the things, and with try and error, and as we go along it can be modified, all other things. In assessment, as is pointed out, of course AI have some of the job which we usually do, for example technical flaws of the item. Even you can train ChatGPT to find the technical flaws. Some of the people are working over to have some app related to those things as well. So some of the things which can be done easily because of the people sitting there looking for each and every MCQs, working around what are the technical flaws, how to work around for those things. Even the post hoc analysis, if AI can work around, flag those of the questions, and even suggest what need to be done, because it was flagged by recently by the different software as well. But once we set it AI, it said that although you need to exclude that question, you need to modify that question, that question is repairable based on those things. So these are the areas which are already working over for assessment making. Also the systems are already there. Is a huge area of even the assessment, not only creating post hoc, pre hoc, so every area AI can be incorporated. So it's not about one tool, it's about working with the whole curriculum team from different area, before, during, and afterward, how to work around it. Even development of the things as well, that AI should used or not used, and within the classroom we don't have any issue with the assessment which is going on campus, with the controlled environment, closed systems, even it computer based. So AI don't have such issues for there as well. But for the formative assignments, for people take home assignment or such kind of things, they have the role. So it's not one size fits all. Based on the courses curriculum, we need to work around for those things.
Great. Thank you so much. I don't see much more questions apart from a
Great.
lot of thanks and a lot of connections. Yes, Dr. Masood has wonderful, well-established YouTube channel. Go and enjoy his talks. One question again from my side. If we look with the perspectives of faculty developer, we understand that it is important to start running some kind of awareness about AI in medical education and start doing some kind of brainstorming sessions in workshops or small group discussions among faculty members. However, if someone want to further grow career in AI in medical education, especially, or do some kind of certificate related to personal professional development, would you recommend some course which you think that will be very much helpful? Because a lot of institutions internationally and nationally, they are offering these courses. So what is your opinion on that? Can you hear me? There is some
Can hear
internet
if it's
issue.
issue with my side or Dr. Shazia's side.
Can you hear me now? Hi, Dr. Masood. Hello. Can anyone hear me? Can you please use chat box?
Yeah,
if
Dr.
you can?
Shazia, we can hear you very
Hear
clearly.
you
So perhaps it might
loud
be
and
his.
clear.
So maybe some issue towards Dr. Masood internet connectivity. So let's wait. He'll be back. Oh, he disconnected. So let's wait for a few minutes for him to come back. Meanwhile, in audience or participants, if they want to unmute and throw some question, you're most welcome. Otherwise, I really enjoyed a lot this talk, and especially I'm very much curious to explore about all of these apps, especially course development and PowerPoint presentation. That's amazing.
Good evening. Hello.
Hello.
Good
Who is-
evening.
Good evening.
I'm Yusra from Iraq.
أهلا وسهلا.
أهلا وسهلا بك. I'm very pleased and enjoy this meeting. Thank you for this information. I really want to improve my teaching skills. I am assistant professor in gynecology and obstetric in Nineveh College of Medicine. My question is there any program or website or application about this artificial intelligence? And thank you.
So anyone from audience can, Dr. Masood is back. So thank you so much for
Yes, I'm back.
rejoining.
Sorry.
Yes. Yeah, no
Yeah.
worries. That's techie issues. So
Yeah.
there are questions from audience that if they want to do some kind of personal professional development course in AI, or they want to learn more about AI in medical education from website, is there any kind of a complimentary free course or maybe paid course which you would recommend?
Yes, there are many courses on Coursera or edX. If you go there, even the Harvard runs some of the courses. There are some free courses, and there are of course paid courses. So I have done 2 or 3, but they're just okay. I cannot say that it's really give me much of that. More of the theoretical aspect, some of those areas as well. But there are more courses are coming up, and people can utilize them. Even if I'll aware of something, just drop me an email. If I find something good, I'll even check from those aspects and reply. One of the course in which I'm also taking part with few other members who are developing, that course was practical skills, not of the theoretical aspect, from the teaching, assessment, personalized learning, evaluation, and what are the different tools and how to make sure that you productive in those kind of tools. But of course that is not available, and it will be not free. It will be a paid course, but maybe once it is there, you can look around for those things. If you found it feasible, you can join, and just drop me an email. If I found something good right now which is available, I do suggest.
That's really great. Thank you so much. Yes, Rabia. We are coming towards
Hello
end of the
everyone.
session.
Assalamu alaikum. Can you
Walaikum
hear me?
salam. Yes, we can hear you very
Yeah,
Yes.
well.
so I was one of the students of Dr. Masood when I attended a course of artificial intelligence in research. So that is a paid course, but it was so wonderful and it was so wonderfully designed that we did all the steps of the research, starting from generating ideas till the end, and we also did the hands-on as well. So it was really amazing that there are so many applications available, and we know that, but we don't use it that often, and we don't know which ones are free and which ones are not. So they used to tell us, and then we used to do it at that time. So we know that for literature review, which one is good, for idea generation, which one is good, for write-up, which one is good. So it was a wonderful course. So I can recommend people, they can opt that course if they are, eager to learn about artificial intelligence and research. That's what I wanted to share. And thank you so much for this wonderful webinar. I again learned so many new things apart from that course today as well. So thank you so much, sir. And thank you, ma'am, for this webinar.
Most welcome. Thank you so much. You have really tantalized our taste bud that now we will invite Dr. Masood for another session that how we can use AI in research. Thank you so much. So
Thank
I
you,
would
Rabia. And that was not a planted question. Comment.
That's really great. That's really great. So I would
Okay,
like to
thank you.
thank you, Dr. Masood, for your time and efforts. And I would like to thanks to all participants who joined us at Saudi Society for Medical Education webinar series. And definitely we shall share recording of this session, participants who registered with us. And now this is time for you to go back and explore these tools and make it part and parcel of your life. Thank you so much. Have a wonderful night. Bye-bye.
Thank you. Thank you.
Thank
Thanks
you.
a lot.
Bye-bye. Allah
Thank
Hafiz.
Thank you.
Allah Hafiz.